You're tuned into Wealth of Health, the podcast series from the Indian Medical Association. Thank you for tuning in and welcome to this episode.
Hello and welcome to the first ever podcast of the Indian Medical Association, or IMA as it is popularly known. I am Dr. R.V. Ashokan, Honorary Secretary General of IMA, and with me today is Dr. Santanu Sen, the National President of Indian Medical Association. Hello and welcome, sir.
Thank you, Dr. Ashokan, my very respected and beloved and very dynamic Secretary General of Indian Medical Association. It's really a good time for me to be with you on the first episode of IMA's podcast series, Wealth of Health from Indian Medical Association. And as Dr. Ashokan, you are the chairman of NTV initiative. Please tell me what can we talk about on this day?
By your leave, Dr. Sen, let us first tell our listener a bit about Indian Medical Association. Indian Medical Association is the only representative national voluntary organization which looks after the interests of modern medicine doctors and the well-being of the community at large. It was baptized in the freedom struggle and it continues to discharge the national duty in health.
Yes, Indian Medical Association is the largest medical organization of the world, which was born in the year 1928 in the city of Calcutta. Later on, the headquarters was shifted to Delhi in the year 1949. Now we are having nearly 1700 branches scattered in the 29 states and 4 union territories of our country, and we are having a membership strength of nearly 3.25 lakhs.
Why a podcast, you might well ask? Well, we at the IMA believe we have a very big responsibility and want to use every medium to reach out to our very valuable audiences, both doctors, medical professionals, and above all to our patients who need proper access to the best of medical facilities and care.
And so, Dr. Ashokan, I also hope that our listeners will find our podcast series Wealth of Health from IMA to be relevant and beneficial. And on behalf of Indian Medical Association, we sincerely urge you to not only listen to but also share our podcast episodes with the doctors and the medical health professionals and the members of society.
Yes, indeed, Dr. Sen. So, let's speak about one of the government's biggest health priorities in India, to end the menace of tuberculosis. And what is that one single thing that private doctors can do to help end tuberculosis in India by 2025? Welcome back to Wealth of Health, the podcast from IMA. Tuberculosis, or TB, has been a scourge of millions across the world. Ending the disease in India has been one of the biggest challenges for the government of India.
The Indian Medical Association was in the forefront to demand to make notification of TB mandatory in the country. And as you remember, in the year 2012, India declared tuberculosis a notifiable disease. The government has also sanctioned an additional $100 million of expenditure per year for the mission to end TB by 2025.
Yes, Dr. Sen. However, there is one obstacle. If this could be taken care of, the monitoring and care of the identified TB patients could be streamlined very effectively.
Yes, in fact, if we really want to make India TB free, then to make the TB free India mission a success, the notification of TB patients by private doctors, it has to increase by leaps and bounds, otherwise we can't reach the goal. Actually, the annual number of TB cases that are being notified by the private doctors, it needs to increase tenfold at least, from 0.2 million, which is now, to 2 million annually, or to around 56% of the total case notification by 2020. And the challenge is that while more than half of all TB patients in India seek care in the private sector, the notification of the private sector are way behind those in government hospitals, and that is really a problem.
And notification, as our listeners might know, is the process by which the treating doctor registers the TB patient's details in the national database.
Yes, and IMA had demanded that the notification of TB be made mandatory in India. It was our long-standing demand because notification has great advantages. You see, once a notification is done, it helps the national program to keep track of a notified TB patient, isn't it?
Yes, indeed, Dr. Sen. Notifications are absolutely essential. But first, let us state that drug-sensitive tuberculosis is definitely and undoubtedly curable, provided it is treated as per standards. But one has to complete the treatment.
But often when patients respond to initial treatment and feel symptomatically better, they become lax and do not persist with the treatment that is essential, with the result that their drug sensitive TB can worsen into a drug resistant one.
So, notifications are essential, critical actually. So, why are the notifications so low in numbers in spite of the obvious advantages?
Yes, there could be several reasons that you can understand. The private doctors are doing a good job of treating TB patients who come to them, of course. But very often there may be pressure from the patients themselves that the doctors do not notify the government that they are TB patients due to some social stigma.
Yes, patients do not want anyone to know that they are suffering from tuberculosis. TB patients are afraid of social rejection and isolation, even from their families and friends.
But if diagnosed early and treated effectively, there is a high possibility that the disease won't spread to anyone else. And moreover, TB can affect anyone, be it rich or poor.
Yes, Dr. Sen. The patients need to be told that the notification is only to help them stay on course for the full treatment and monitoring so that they complete their recovery.
Because this doesn't happen and because people drop out, India has a high number of TB relapses.
So it is very important that patients are informed about all these aspects. It will help to convince in notifying the disease and will give a boost to India's battle against tuberculosis.
Yes, Dr. Ashokan. And having said that, let's now try to understand and address the issues that keep private notification at a low level. Let's now try to understand and address the issues that keep private notification at a low level.
Absolutely. And one of the issues is the confidentiality. TB still carries stigma and patients seek confidentiality. The notification program is addressing this issue. It has made the notification process completely online, digital and paperless.
Another issue is with patient data itself. See, patients might not have a permanent address and many may be living in slum areas without any proper address, or their documents also may contain an incorrect address. So linking with Aadhaar for the direct benefit may help deal with this. It's also important to remember that notification of TB patient is now a legally mandated requirement. While the invaluable work done by the private doctors is fully acknowledged and appreciated by everyone, the government has at the same time also gone ahead and made TB patient notification mandatory.
It's now very easy to do notification of the patients. The national program has developed a web-based program named Nikshai, where details of the TB patient can be entered both by public and private doctors. So, Dr. Sen, how have private doctors responded on the notification side?
See, the notification from private doctors remains below par. It is not very satisfactory till now. And considering more than 50% of TB cases are being treated by the private doctors, it is very, very important the private sector notification improves significantly.
Yes, Dr. Sen. The dearth of notification means significant numbers of TB cases are being missed by the TB notification system. Nearly 1/3 of the world's missing TB cases are from India, with around 1 million such cases believed to be managed by private doctors. So, the one single initiative that will empower the national mission of putting an end to TB in India by the year 2025 is stepping up of the notification efforts so that the patients can be tracked, monitored and treated to complete recovery and full cure.
With hundreds of thousands of patients across our country of an infectious airborne disease that is fast becoming virulently drug resistant, ending TB in India is a top priority, and the notification of TB patients will be a very telling factor indeed.
And since they treat more than 50% of TB cases every year in India, in our fight to end TB by 2025, it will be the private doctors and the notifications from them that will play a crucial make or break role.
And we are sure that they will measure up to the task and responsibility in the same spirit with which they have always served our country and its people.
Yes, indeed, Dr. Sen. And with that, we come to the end of this episode of The Wealth of Health, the podcast from Indian Medical Association. Thank you, Mr. President, Dr. Sen, and thank you, my dear listener, for your time, attention, and support.
Thank you, my dear Dr. Ashokan. And I would like to say that the Indian Medical Association is committed and united to end TB in India by 2025. So it's crucially important that private doctors notify TB patients through the Nikshai app.
Indeed. Thank you, listeners. Till next time, bye.